Now, more than 1 in 5 women in England will face a mental health challenge during pregnancy or after birth. That's one of the findings of the Maternal Mental Health Alliance, which has published research suggesting many of the 46 maternal mental health services in England are struggling to cope with the levels of demand. It also says the type of care provided varies from area to area. Maggie Gordon-Walker is the founder of Mothers Uncovered. It's a group of mums in Brighton and Hove, and they support women and families. Maggie joins us now. Maggie, good evening. If you could tell us a little bit about the work that you do and how many women come to you, and is this increasing? Can you see the increase here?
Good evening, Jeanette. Yes, certainly. So we're a charity project based in Brighton, and we use creative peer support to help women deal with the isolation, loneliness, recover from birth trauma, financial worries, a whole range of problems. So we've worked with probably around 3,000 women since we started in 2008. And I would say levels of trauma are going up all the time. It was exacerbated during COVID and the pandemic when so many women had to give birth alone. And many services closed then and have not reopened. So women are really, really struggling just to get through the day.
What kind of personal challenges have you heard about or that certain women are faced with, and what can you help with?
So, yeah, it starts in birth, as you mentioned in your intro. So, we had the Ockenden review just last week about the continuing failure in maternity wards. So many women have a traumatic birth, and we're talking about things like prolapses, hemorrhages, and these continuing health problems spiral then into them needing more dedicated care, which they're then having trouble accessing. So I looked at the report this morning that there's none of those 46 places are in Sussex, which is where we're based. So we run our groups for up to 5 weeks supporting 8 mothers, and we kind of struggle to keep going because we don't have funding regularly when we're not a statutory service. But it's so very much needed. I mean, we have saved many lives. Women have come to us and said, you've saved my life. Without you, I wouldn't be here, which is amazing, but also kind of quite a big responsibility.
It's a huge responsibility for any charity to take this on because, as we're probably seeing in the research, this is something that is increasing. Do you think, since you've become a mother 7 years ago, you speak about struggling at the start of that, how much has changed since that time?
I actually became a mother 20 years ago.
20 years ago.
20 years ago. I set up the charity 16 years ago. But yeah, I just think it's increasing year on year. It used to be that we'd have a mother who we were seriously worried about, maybe one mother every 18 months. Now it's several a year. And yeah, as I say, the problems just kind of exacerbate because as well there's financial worries. As we know, we're in a cost of living crisis. So many women are frightened about how they're going to pay the bills. And they don't speak up because they feel guilt and shame, because if they do speak up, they're often told to stop moaning and just get on with it. And they are grateful to have a child. I was grateful, and yet I struggled and really needed a support group to boost me and to give me a community going forward. And what makes me so annoyed is that peer support, which is what we offer, is so much cheaper, and it creates a whole community that will support a mother for months or even years. So one of our groups is only £1,500. That's the cost of a hospital bed for one night.
When you think about the assessment time that it takes, how much does that concern you? Because you're looking at anything, up to 26 weeks at times. That is something that potentially needs to be cut to really help these women, or?
Yeah, and I would say that's a conservative figure. I mean, we supported a woman last year who'd been on a waiting list for 9 months and then just received a letter to say, was she happy to still stay on the waiting list? It's way more than that in certain areas, and that's what the report also showed. It's very patchy care. Some areas are better served than others. So most of the women who come to us have been sitting on a waiting list for months and months and months just to process their traumatic birth so they can get on with enjoying their life and raising their family the best way they can.
Is there anything that can be done in terms of community, in terms of network, in terms of family, to help these women that are struggling with their mental health, pretty much whilst they're pregnant and in the immediate aftermath of birth as well?
Certainly, family help is hugely important. I think what we notice, though, is because women tend to have babies later than they used to, they often don't have that family network around them, and they've probably been working right up until the point they've given birth. So that's why isolation is such a key thing. You know, they've got this newborn, they've perhaps had a horrendous birth. They don't know where to go to for support. And if they go to a kind of informal drop-in and they're carrying all this trauma, they need a kind of dedicated space so that they can process that and then be able to move on with their life. And that's best served by other people and it being facilitated by someone who's there to do that.
Who do you think then, Maggie, are the stakeholders that need to be lobbied here to really understand the impact of maternal mental health?
Well, obviously the government, and, you know, it's been the case, you know, year in, year out, is we never invest preventatively. We wait for something to go wrong. So the previous report that the Maternal Mental Health Alliance did said it cost the country £8 billion every year in inadequate maternal health care. So if you invest preventatively, then you save money in the end. As I mentioned to you, you know, one of our groups is so much cheaper than someone making a suicide attempt. And sadly, that is the leading cause of death in new mothers is suicide. So if someone ends up in hospital because they've got into such a severe state of depression, that costs so much more. So you just have to, policymakers, the NHS, they need to invest not only in the one-to-one therapies that they're providing, but also they need to invest into the community, into the peer support groups that can best support the mothers. And
Maggie, if there are women that are listening and they are struggling and they're not quite sure where to turn, where can they find help when it comes down to Mothers Uncovered?
So, yeah, we're based in Brighton and we stretch across into other parts of Sussex. We also do run some online sessions for parents of special needs children. So they just need to go find us, mothersuncovered.com. And as I said earlier, we're continually struggling to keep afloat in the financial crisis. So if anyone has any money to spare, we would always welcome a donation.
Maggie, thank you so much for coming on this evening. That's Maggie Gordon-Walker. They're the founder of Mothers Uncovered, speaking about this statistic here. 1 in 5 women in England will face a maternal mental health challenge.